So my name is Dr. Dominique Smith. I'm an OBGYN, practicing just GYN only for the last 2 years. So I guess my evolution, I guess you go from the oldest to the youngest now, right? In the GNLD family. I'm not age-wise, but I'm probably the newest addition to the Carmack physician team. My evolution has started about 2-3 years ago as I started looking at women's health in a different light. In terms of my patients would come to me for their annual physical exam. And what I did for them was a pap smear and a breast exam and sent them on their way. And it just kind of started dawning on me that that really was not a wellness exam or a wellness check. So as I did more research in terms of like, well, what is well? What is the definition of well? It led me through the path to kind of really realize that well is just being balanced, in essence, and making sure that your body is prepared for the stressors that you will encounter in your life. Okay, so balancing means, you know, as a gynecologist, primarily to me, hormonal, you know, of course, balanced hormones. A lot of the ailments as females, and men as well, that we experience have to do with imbalance in our hormones, and not just, you know, estrogen, progesterone, which are the classic things that we talk about, but stress hormones, cortisol, thyroid, those are all hormones. And when they become off balance, that makes us unwell. And they're, you know, as doctors, we're really good at diagnosing illness, but not necessarily at maintaining health. And so my process in terms of how it brought me to GNLD was trying to find good products to recommend to my patients that would help them to prepare their body for stressors, as I talked about. And stressors does not just mean emotional stress. When you say stress, most people think of, you know, somebody yelling at you or an altercation. But stressors means the foods that we eat in our body, the foods that we present to our body that are not good, healthy food choices for us, that causes stress. Environmental toxins, all of the pesticides and, you know, things in the air, the volatile solvents, going to the gas station, lead, all the things that we encounter, those are all stressors to our body. And so what we need to do, since we can't eliminate or avoid most of them, is prepare our body to deal with stress. And that's what I tell my patients all the time. And so that process mostly means supplementation. Obviously, eating right, balancing your hormones, exercise, those are all very important towards living a good, healthy life. But also, most of the time, the American diet does not prepare you to deal with the stress and to be able to fight the toxins in our environment, and supplementation does that. And that's kind of what, again, as I started looking around for products for my patients that would help them to be able to prepare their body, I came across GNLD just basically by happenstance with exercising with my personal trainer, Ms. Carla Fields. Happens to be the trainer at the GNLD Wellness Center, and as part of my exercise routine with her, I got exposed to the GNLD products. And for me, you know, when I learned more and more about the company, this was an all-inclusive company. And instead of really trying to find a good one a day and then a good vitamin D and a good omega, and you can find those in various different companies. You might have good vitamins, you know, and not to say that GNLD has the only, Dr. Carmack might not want to hear this, but has the only choices. But however, the company is one that I have found that has everything under one roof. And so it made it easier for me as a physician to be able to have one-stop shop and know that there are product lines that are all natural, whole food products, no fillers, synthetics, no organic pesticides, none of that stuff in the products. And so when you are recommending that to your patients or your friends or family, because I take them, I have my kids on them, I'm confident in that how the products were prepared and presented, and that it will help us to prepare for what we need to be prepared for in our environment. So with that, I'll pretty much stop talking and let the panel, and then afterwards, maybe if you guys have questions, I can delve into more details. Okay? All right.